Hi everybody, it's Carrie here from Midwife in Detroit. Once again, I want to thank everybody who's liked and subscribed to my channel, who's commented and shared the video. It really means a lot that you guys are helping me grow and helping other women learn about their bodies. I am working with some new equipment, trying to upgrade my game, and I'm trying to work on some lighting, so I hope it doesn't look like we're in a scene of Are You Afraid of the Dark? But as I am not perfect, although I'd like to think so, I am going to work on modifying this if it doesn't look good on my computer. So today's video is about 10 questions women are afraid to ask their OBGYN or their healthcare provider. So honestly, we get asked silly questions every day, and at the end of the day, we have to remember that as a healthcare provider, and I have this vast knowledge on what's normal about the woman's body, I have to remember that not everybody's received the same education that I have. So I would like to say that there's no such thing as a stupid question. However, that is untrue. But these questions are not stupid questions, so let's get into it. The first question is, I'm on my period. Can I see my healthcare provider? Well, I would say that it depends on what you're seeing them for. For maybe a general checkup, or if you're just having your normal physical exam without your pap smear, which we'll get into that in a minute, I would say it is okay to see your physician while you're on your period. If you're not bleeding too heavy, because if you're bleeding really heavy and we are looking inside at your cervix, sometimes too much blood can cause it to kind of be hidden. And it also depends on what you're visiting your doctor for. If you want something like an evaluation of your discharge, or an evaluation of something that we have to see visually, sometimes the period blood will actually get in our way. So I would suggest, if it's not too much trouble, for you to reschedule your appointment. However, if you're coming for a refill on birth control or something of that nature, seeing your healthcare provider while you're on your cycle is no problem. The next burning question is, should I wax or shave before I see my provider? And I would say, don't do it special for me. If this isn't in your normal wheelhouse of grooming, don't shave or wax just to come see me or your healthcare provider. It really makes no difference to me on how little or how much you groom. So whatever you're comfortable with. So if you like it au naturel, that's fine. And if you like hardwood floors, that's fine with me too. The next question is, should I be concerned about vaginal odor? Well, that's kind of a loaded question. And what I would tell you is your vagina cleans itself. That's essentially what our discharge is. It's kind of just maintaining a normal balance. You have good bacteria that police or keep control of the bad bacteria or fungus like yeast. So I would say you should be concerned about your vaginal odor. If it smells kind of fishy and it doesn't go away within a few days, if it smells really bad and is accompanied by any abnormal discharge, like yellowish, greenish discharge, and I would say as long as you're not having painful sex, but you know what, any abrupt changes in what you normally experience during the month with your vaginal discharge, you may warrant a good appointment with your OBGYN or healthcare provider to get it looked at by a professional. And one thing that you do not want to do if you have any vaginal odor is please don't douche. Please do not rinse out your vagina with any solutions. Your vagina, like I said, is such a complex environment. And if you have an STD or an infection, you can actually advance it, or you can actually make problems worse by washing away your good bacteria and allowing the bad bacteria to overgrow. So like I said, if you are experiencing an abnormal vaginal odor, I would say going to your doctor and having a professional look at your lady parts is not a bad idea. There's two common infections that women get in their vaginal odor. One is the yeast infection. This can typically have kind of like, I would say, a musty smell. And it would be accompanied by pretty good intense itching that's either on the outside or inside, and thick white vaginal discharge. The other infection that's very common in women is bacterial vaginosis. Bacterial vaginosis is typically, in most women, accompanied by a thin, watery discharge that may have a fishy odor. So both of these infections do require some medications. Yeast infections, typically, if you've had a yeast infection, you know what that feels like, and you can treat it with over-the-counter medications. But bacterial vaginosis should really be evaluated by your healthcare provider to determine the best medication for treatment. Our next question is, can I get pregnant while I'm on my period? And the answer to that question is no. Your period occurs because it's prepping and flushing away the tissue from your last month's period, and because you didn't get pregnant. So it needs to get rid of the old tissue in order to create an environment for the next potential pregnancy. We can only get pregnant when we're ovulating. So if you check out my video on what to know about your menstrual cycle, you will get some good advice and some good information on what's normal during your period. But you cannot get pregnant on your period. The next burning question is, how often should a woman get a pelvic or a pap test? So I would say that this depends on your individual circumstance. At a minimum, every woman should see their OBGYN, midwife, nurse practitioner who does their annual female visits annually, once a year. Now, a pap test or a cervical cancer screening does not start until age 21. And depending on your risk factors and depending on what the result of your pap test is or your cervical cancer screening would depend on when you see the doctor again. Now, if you start to experience anything different or any changes in your health, such as abnormal bleeding, pelvic pain, vaginal discharge, you have a new sexual partner, I would say that it's a great idea to go and see your healthcare provider just to make sure that nothing's abnormal. So the answer to that question is, a woman should have a pelvic minimally, and they will have a pap smear or cervical cancer screening depending on when their last one was and what was the result of that. The next question is, what is that bump down there? Well, I would say one of the two main causes of having abnormal bumps or lumps down in your vaginal area would be either genital warts or it could be herpes simplex virus. And I would say that in order to get the best and most conclusive result, you should contact your healthcare provider to get it looked at. You know, a lot of people who shave or who wax or who have history of ingrown hairs or infected hairs like folliculitis or hidradenitis, they experience a lot of lumps and bumps in their groin area. But these people usually have a clinical diagnosis. So if you're experiencing any changes in your vaginal area related to lumps or bumps, especially if they're accompanied with pain or itching, I would say go see your healthcare provider and get that bump checked out. The next question is, why is sex painful? Well, I would say that painful sex is caused by numerous things. And as you get older, like mid-30s to 40s and beyond, the most common cause would probably be lack of vaginal lubrication. There's lots of great lubricants out there for women to have more enjoyable sex. Because as we get older, the vaginal walls do change and they don't lubricate as much, and they also become quite sensitive. I would say getting a water-based or silicone-based lubricant is best. Stay away from things with harsh chemicals. Don't use Vaseline because that allows the bad bacteria to overgrow and lead to things like bacterial vaginosis and yeast. Another common cause of painful sex would be vaginal irritation caused from a vaginal infection, like the ones we've talked about, which are yeast infections or bacterial vaginosis, and sometimes a sexually transmitted infection. If you have pain deep inside when you're having sex, you could have an abnormality with your uterus, something like fibroids or ovarian cysts. So if this vaginal pain or painful sex is new to you, you might want to go see a healthcare provider. Another really common and not really talked about condition that women have, it's called vagismus. It's kind of like a psychological reaction to vaginal penetration, where the woman experiences a vaginal spasm. If you are having any of these spasms or inability to have sex is one of the common features. So if you are having any of these symptoms, go see your healthcare provider. The next burning question is, why do I pee when I sneeze, laugh, cough, or do exercise? Well, ladies, for those of us who have had children, this is called stress incontinence. There's a few different types of incontinence that you may experience, but one of the most common causes is kind of muscle weakness in our pelvic area. So as we get older, as with all of our muscles, they become a little bit weaker. So we may experience some urination with laughing. I've even done it while yelling, sneezing, coughing, or exercising, or in my case, yelling, where I've leaked urine. And one of the ways that you can remedy this is doing Kegel exercises. These are a tightening of your vaginal and pelvic muscles to help strengthen and give you some bladder control. But if it's getting to the point where you are having to change your clothes or it's happening more often than you think you should, I would say, once again, go see your healthcare provider because they may be able to assign you some pelvic floor therapy that may help you utilize these muscles more efficiently so you don't have those problems with leaking while coughing or yelling. The next burning question is problems with sex drive. Now, well, this could probably be a whole video itself. I would say that problems with sex drive happen in many people now and again, and it can cause some psychological distress or problems within your relationship. Some of the most common causes of low sex drive are being postpartum, breastfeeding, menopause, because these all are changes in our hormones that help us become aroused. Other problems could be stress or depression. So if you find that your problems are becoming bothersome to your life and causing problems within your relational status, I would definitely say go see your healthcare provider. And the last and final question, which I'm sure that all of you have experienced and really want to know about, is queefing normal? And I will tell you, yes it is. So queefing, or the vaginal fart as we all know it, is when air enters the vaginal canal and exits similar to a fart or passing gas. And this can happen during intercourse, this can happen during exercise, and just like controlling your bladder, increasing your sex drive, One of the ways to control this is by doing Kegels, strengthening those vaginal muscles. So when you're doing exercising and engaging or squeezing those muscles, air won't be allowed in, so then air won't have to come out. So I hope that I've answered all of your burning female questions. If you guys have any more questions or something that maybe's on your mind and you're too embarrassed to talk about, leave them in the comments below. Please like and subscribe. Please share my videos. And once again, thank you so much for joining me. Bye-bye. Have a good night. To put you, or I swear, Rocco is a camera hog. Sorry, Rocco. Well, we have a visitor again. Know when you are ovulating. Rocco, my executive producer. I'm working with some new equipment, so I hope it doesn't look like we're on a scene of these fucking animals. Oh, I hope this looks good.